So what goals does a robotic surgeon have for his patient when he embarks on the surgical procedure itself? There are a number of goals that we as robotic surgeons have when we go in and do a robotic surgery. First and foremost is curing the patient of their disease. Unfortunately, to the naked eye, prostate cancer looks very similar to normal tissue. And when we do this surgery, you don't see a great demarcation between cancer tissue and normal tissue. But the goal, the ultimate goal of robotic surgery is to get all the cancer out and have negative margins. In patients that have more extensive disease, if we believe the disease is outside the prostate, as surgeons, we can swing the margins a little wider to make sure that we get negative margins. In some ways, a robotic surgeon's eyes become their hands. When we do open surgery, we're allowed to feel tumors that are palpable. With robotic surgery, you don't have that sensation of being able to palpate things, so your eyes become your hands and are able to see where things are. If you see differences in tissue colors and so on and so forth, you may want to swing a margin out a little wider to ensure that you get a negative margin. We like to try to preserve the neurovascular bundles when we do the surgery. We know that the nerves that supply the penis for erection run alongside the prostate, and we can peel those nerves off like peeling an onion skin off an onion. And typically what we like to see is we like to see two bundles after we've taken the prostate out in the prostatic bed to represent where those neurovascular bundles are. Not only do we believe that that's important for erectile dysfunction and erectile function going forward, but there may be some link to incontinence. We like to see a nice stump of the urethra and a nice small opening of the bladder neck. And those are important because I think those help with urinary continence. So as a surgeon, what we like to do is, one, make sure that we cure the cancer. Two, we like to see some anatomical landmarks of where we know those nerves are. And three, we like to see a good long stump and a very small bladder neck to sew things back together, because we believe that all of those factors may have some impact on urinary continence in patients going forward.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.